Thought you had to go see some insurance company today and do some kind of a little blood blood draw physical. No big deal. It wasn't major cardiac surgery, so got to that one with ease. But I have to talk to my cardiologist, my cardiothoracic surgeon, in a couple of days. And even unbeknownst to the bystander, I've been doing some pretty intensive review of the literature about when surgery is indicated for certain, in my case, valvular heart disease versus medical approach. So you may be asking, like, a guy like you, how do you approach that before you go to the doctor? You're a doctor with a, and you specialize in the heart, which is what I do specialize in because I read echo, and that was what I did, stress test and echo. So that differentiated me from other internists who weren't trained to read echo, and I could do echo as well as an ER doctor. We do fast exams, which is looking for major intrathoracic injuries quickly using ultrasound. So yeah, I'm trained to use an ultrasound machine. I'm better at reading it than getting the pictures, but that's what we have text for. So when a person trained such as me, before I go and sit down with another professional in a field that's similar or that I'm not an expert in, as I am in internal medicine, you would say, I sit down and I ask what was the problem. In my case, the problem was easy. It was sudden death. So you can go look up sudden death. That's real easy. You can see what the risk factors are for it. You can get more specific. You can say sudden death and mitral valve disease, and you can look up the numbers. You can see what the risk factors are. Blah blah blah. You can see how you treat it. Do you put in one of these intracardiac pacemakers like I have? Namaste. Which I have a box in me now that costs what, $100,000? Apparently, I have $100,000 box on this side of my chest that monitors my heartbeat now. And if my heart were to go crazy like funny rhythm, it would shock the living shit out of me. So that's one treatment. But physicians are asking always, what is the problem? What is the core problem? See, so when I go to the surgeon, the first question is, oh, if I let you replace my heart valve, is that going to reduce my chances of having cardiac death again? The answer is already no. I know the answer to that question. No. So see, that's why it's not as straightforward as you would think it would be. You would think, oh, the problem must be the valve. So if I get rid of a valve and fix it or put in a new valve, appreciate the love, appreciate the love always, because I'm giving y'all valuable information on here. I'm telling you how to think like a doctor, so when you go and talk to a doctor, you make sense. So what we do is we sit down, we pull the literature. I go to Up to Date because that's a physician site, Up to Date. But you can use the World Wide Web and research these problems. You know, you need to know what the primary problem is when you're going to see the surgeon. The primary problem I had was I blacked out because I wasn't going to him before that being assessed for heart surgery. I was going to a different cardiologist, and we had already established that I was going to have a repair of my mitral valve at the Mayo Clinic, and I was already being worked up for that with one cardiologist. It's just that this blackout I had happened after I was already established with him. Everything was in the works. Okay, so that reset everything. Now the whole board is being wiped clean now. Okay, we can't worry about that problem. That problem we were worried about was chronic leaky valve. That's done. Now we're worried about, okay, now you had sudden death. How do you prevent sudden death? Well, you put in a pacemaker like this one that shocks the shit out of you if your heart goes crazy. So that problem actually has been dealt with. I may get shocked a few times, but likelihood is that I won't just die. Likelihood, highly high risk reduction of that with this device in me. So now what are we looking at? Now you're really looking at long term. If you have heart disease, you're looking at long term. Like, okay, how do I, am I losing function slowly? this valve is leaking. So I do I do echo? Yeah, of course you do serial echocardiography, echocardiograms every couple of years if you have a valvular heart problem. I would say every 1 to 2, depending on how bad it is. And you can look and see a linear progression if your heart is enlarging, if your left atrium or left ventricle are enlarging, if the muscle is getting thickening and hypertrophying. You can see all that with the ultrasound. Ultrasound is a great machine for the heart. I'm glad I learned to read echo ultrasound of the heart because it's the most valuable tool I have because I'm not a heart surgeon. I can't go inside somebody's chest and look at the heart. So for me, as an internist who specializes in echocardiography as my subspecialty that I studied outside of internal medicine, it's an extremely useful tool when I sit down with these surgeons and I know these numbers already. Talk about left atrial enlargement or 4 centimeters. That's normal left atrial size, right? Left ventricular size 5.4 versus 4.0 if you're talking about end diastolic versus systolic diameters. These are all numbers that you just know if you study cardiology. So when you go talk to somebody, you can be like, what the numbers say. You can start right there. You may not have pinned down the primary problem, but at some point, the conversation is going to move to what does my heart look like structurally? How big are the chambers? What's my ejection fraction? Is it over 50%? 50% okay. It's not great. If you're athletic, it should be at least 60 to 75%. How much blood the heart squeezes out. So they're definitely going to look at that. But the whole point of valvular heart disease, like what I have, mitral valve, my aunt told me the other day that a bunch of people in my family have this condition. So a lot of people out here, people of color, Mediterranean descent, you guys have mitral valve disease in your family, a leaky mitral valve, and you don't even know that my aunt said that one cousin has it. I think she has it. My mom has it. So I know that it's an autosomal dominant gene. It's on my mom's side. It's obvious. There's obviously a gene in my mom's family that fucks up the cartilage and the mitral valves of our heart. It makes the valve not structurally sound or too weak, or slowly degenerate. We don't know the mechanism yet. That's where the research needs to be going. Okay. The research needs to be going towards the mechanism. Like when they did the studies on the rats and they gave them a certain component from beans, they were able to induce this sort of myxomatous degeneration of the heart. So there are laboratory bench level studies, but with that kind of information, what do? I got some kind of substance from a bean. I shot it up into a rat, and I was able to make his mitral valve look abnormal. What do you do with that information? Okay, so it gets complicated. Okay, because you don't have that information yet. You don't know genetically which gene is coding for this. You don't know, do you replace the gene in vitro or in vivo when the baby is in the mom? Should you introduce actual gene therapy? Because that's where it's going. This is going to, let me fast forward to the future for you guys. Couple A, couple B, you're gonna get married. Your child's gonna have mitral valve disease because the mom is autosomal dominant. Do you want me to do gene therapy on your child, which means flood that child's system with the correct genetic code to replace the incorrect code that the mother or father is autosomal dominant? Or do we use viral vectors? Do we use viruses to introduce healthy genes that we need into people? This is where this is going. Okay, I'm moving the clock forward about 100 years, 50 to 100 years. This is how we're going to treat mitral valve disease in the future. We're going to introduce the correct gene before the child's heart is even formed. We're gonna introduce the correct gene. Okay, and then the heart's going to develop normally, and the vector may be a virus. Just so you know, it may be. Maybe you put it in a lipid vehicle like you did, coronavirus vaccine, and just flood the baby's heart with this genetic material that's encoded in lipids. I don't know. This is cutting edge. I'm telling you, and I'm telling you how it's going to be done and how it's done now. In this day and age, what you have to do is just follow it. If it gets worse, through chamber sizes, echocardiography, functional status, stress testing. Then, you have to go to the cardiologist once every couple of years, get reassessed, and then he'll look at the chamber sizes. If they get too big, and if your heart's ejection fraction starts going down, he'll probably recommend surgery. But you got to be the one to know the absolute indications for surgery. If you're sitting down talking to the surgeon, you should do that research. You should say, well, I don't have an absolute indication, because in my case, I know for a fact this surgery is not going to guarantee that I don't drop again. It's not going to prevent sudden cardiac death. This is a structure. This is a surgery we're contemplating because my valve leaflets are prolapsed. And the question is, do we go ahead and put in an artificial valve before I lose any chamber function, before my left ventricle gets dilated? That's the conversation we're going to have. And also whether my functional status would be decreased, because in some cases, if you take a healthy valve out and you put in an artificial valve in a person that has good functionality, there are some studies out there that show you decrease a person like me with a high level of athleticism. I can go downstairs and go straight for an hour, kicking a heavy bag. Even right now I could do it, kicking a heavy bag, punching it, lifting weights, blah blah blah, straight hour nonstop. So am I going to lose that if I let you put an artificial valve in me? That question has to be answered. The fact that you're not going to fix my risk of sudden death, that's going to be addressed. Okay. Then the hard numbers, which is just what my chambers look like, that's easy. We get the echocardiogram for that. Then we go to the proper, American College of Cardiology has recommendations on when to replace a valve that's not functioning, and they have indications for that. And so you sit down and you look at the indications and you say, do I fit in these categories? For me, it's most likely it's going to be chamber size. If one of my chambers is suddenly enlarging over what it was a year or two ago, well, maybe we're going to talk about replacement, because we can't repair mine. I know we can't repair it because it's both leaflets. It's not just one leaflet. So this is when you have to come in and do a repair. So this is the kind of information that you have to go to the doctor with. You got to know your history good enough to be able to say, hey, this has been a change. What's up? Sugar booger. But do your own research, man, before you go and talk to these surgeons. I got a list in my phone. I got a list of graphs and shit I've been pulling up when I read. And I'm going to say, what about this? What about this? What about that? He's going to answer these questions for me. You convince me that you taking out my heart valve is going to be of more benefit than leaving it in for right now and waiting. I think I'm right. See, the problem with me is I'm one of these on the line people, like on the line, literally. It could get a little bigger, then it wouldn't be good. A little less function, it wouldn't be good, huh?
So your work charges you $30,000.
Who did?
Your work.
My work?
Yeah.
Well, how they charge me?
Remember, that's where you collapse.
Oh, so they charge me? They charge my insurance?
Yeah.
Everybody made a little money off me, huh? That's good. I'm glad they all got their finances together. Off of my what?
They only take care of you a couple of hours.
What's my hospital bill? $100,000? The whole thing?
300.
300.
Including the helicopter.
Including the helicopter ride?
Yeah.
$300,000. That's how much it costs.
Yeah.
And all I got for that was a box in my chest. I don't know shit else about nothing. 300K.
Well, you're in a helicopter.
Oh, okay, yeah, helicopter. You could buy a helicopter for 300K. It may not be a good one. I bet you could find an old rickety helicopter somewhere for $300,000 though. I bet you. And learn how and shit. Maybe get lessons too while you're at it. I know for a fact you can get airplanes that cheap because I've flown before. So you can get a Piper Cub or something like that, or an old Cessna Skyhawk. No problem. So we talk about airplane money now. Maybe not G5 money, but you gotta know what to go and ask and have the right questions you do it a little bit at a time, because even for me, reviewing this much information in a short period of time, like a week or two, I have to go through the information repeatedly, write down what I think is important, and then move on to the next point. I'm at the point now where I pretty much I know the indications for surgery. In which case, it's a lot of it has to do with numbers, numbers in my case, because there's no absolute indication. So it's numbers and chamber sizes and things like that. And so you want to know a little bit of that when you go in. You want to say, you know, talk to surgeons. Talk to surgeons the way you talk to technical people. When you talk to a technical person, when you go and talk to a person fixing your car, do some research or talk to somebody in your family that knows a little bit about medicine. Have some kind of technical question ready, even if it's what's my rate, what's my chance of surviving this surgery. People like me, I mean, do I have a good chance of returning to my previous level of function? These are the basic questions you want to ask, right? And then they're going to get more specific and say, well, because of your age, because you're overweight and you got diabetes, you shouldn't expect to get back to there. You can expect to get back to here. And then they'll tell you why your functional status maybe it won't be as good as another person's. It's crazy how this fucking Hindu dot is gonna stay on my forehead now since I fell down before I died. I must have really went to the other side, man. I'm serious. Since I got this third eye, this is not art. This is not done by a tattoo artist. This was a gift from the universe, huh?
You also should give you a free.
Yeah, I was working there when I collapsed. You would think it would be a courtesy, but nope.
I know, right?
They ain't gonna do no courtesy. They're gonna make their money too. So if you're into studies, pull the medical literature on what you have. If you have coronary artery disease, say you have a 50-60% lesion, you need to go to the internet, into Google, and type in coronary artery disease indications for heart catheterization. It'll tell you when you should do a heart cath. My understanding, I think it's like 70 to 80%, but please, I'm not an interventional cardiologist, but I think it's somewhere. I think even some 60% lesions, depending on other factors, maybe 60 to 65, maybe would get dilated, but I think it's around 70%. Uh, just know the basics about your condition before you go and talk to the surgeon, and the conversation goes a lot smoother. It's not you just staring at him while he's talking to you. Very specific questions like, what are my chances of survival? What are the risk of a bad outcome? What are the chances long term as far as recovery? Should I expect to be able to recover and reach my previous level of functioning or not? If not, why? And what's the benefit of that surgery if I'm not going to be at that level? Or if it's just a gamble, then I guess that's on me, right? If it's a gamble, 50-50, hey, I put the new valve in, you're a new man, or I put it in, you know, but you can't blame the surgeon if you knew before he put the new valve in that there was a risk when he put the new valve in your heart that you weren't going to do as well functionally as you did before. Before you were, ride horses and snowboard, and now you're getting a little bit more tired. Don't get mad, okay? Because you did the research, you knew the risk before you went to surgery. This is the kind of stuff you need to know, man, before you go and talk to a surgeon, because they're real. you know, in my cases, I got to review my echo and see what my chamber sizes look like. Because for me, it will come down really to chamber sizes, because there's no indication for surgery just because I had a sudden death. That's something that's electrical, that I'm sure the valve is contributing to it. Most likely, some structure between the SA node and the AV node and Purkinje fibers. Maybe the posterior mitral, the posterior basal part of my heart has some scarring along the papillary muscles. It's just that science isn't that advanced yet. I would like to know what electrical part, is malfunctioning. But then again, what's the point of knowing if you can't fix it, right? In my case, the scarring or whatever damage has been done to my electrical system of my heart is done. The risk is there. So the treatment is this $100,000 box. Okay. The question is how do you stop the advancement of the disease? My blood pressure was 118 over like 70 today. I mean, I'm not obese. I exercise. So are we looking at a purely structural problem where this has to be fixed or it'll deteriorate in a predictable way? That's something that we'll talk about. And if it's gonna degenerate in a predictable way, now I'm gonna continue to lose functional status from it. Then what's the chances of me reducing that with surgery? You know, um, these are the questions you want to ask, man. Different surgeries require different questions, but what was it like before, during, and after the marriage, so to speak? And pull literature. Go to Google and pull literature. I need to pull literature on mitral valve replacement before I go to see the surgeon. I will pull that literature and read over it because it's just there's a time when you need to do your homework and study, boys and girls. And before somebody's gonna put a knife through your throat and cut you open, it's probably time to do some research and a little bit of homework so you know about your condition just as well as they do. Maybe not as well as they do, but you've gone through the basics of your condition and you know the surgical indications for the problem that you have, and you know the likely outcome of those surgeries based on a person with your problems, your comorbidities, not some Olympic athlete. No, your body, what you're like right now. That's what dictates how you recover from surgery. That's why I recovered so fast from my collapse. 2 weeks, and I'm pretty much back to almost completely normal mental function. But I know what to do when the folk won't do what's right. Doc know what to do. I know what to do. I know what to do, man, and I'm gonna do what needs to be done, man. It's simple as that. I'm taking all kind of shit from my brain right now. All kinds of mushroom fucking lipids and fish oils and shit. They didn't want to give me the CBDs, so I'm like, fuck it. You give them to me, or I'm gonna get them one way or another. So that put an end to all the jerking and twitching and all that bullshit. You got to be your own advocate, okay? No, I didn't feel nothing, man. Seriously, I just passed out. I woke up and they were pulling a tube out of my throat. That's all. My wife said I was in the ICU for three days, unconscious. They kept me sedated for 3 days, and like, what the fuck's that all about? I mean, you can't do an electrophysiological study with me awake. You're doing one right now. It's called an EKG. It's called SCD, AICD, EKG, or just electrocardiac pacemaker. But this is not really a pacemaker I have. It's just I call it a shock box is what it is. It's a box that if your heart does anything crazy, it's going to shock the living shit out of you, and you will feel it. You best believe you're gonna feel it, and it'll stop your heart from going into a crazy rhythm like that. Which is in my case, that was the primary problem. That was always a risk. That's the risk of mitral valve disease. Period. Anybody out there with mitral valve disease, I don't care who you are, you're at risk of that. That's called SCD, sudden cardiac death. You can go look it up. Certain peoples with certain conditions are at risk of that. I'm not sure about just any arrhythmia. You gotta look up the numbers because I was looking up the numbers for my condition for mitral valve prolapse. But these are the things that we in the black community need to share with each other. The white community too. Family members need to share information about. Like my aunt tells me after I die, oh yeah, all your cousins got this shit too. Oh, such and such and such. Like damn, I knew it was hereditary, but Jesus Christ, my mom's side of the family, they're a repository for this heart shit. Okay, so now I need to make sure my kids, as they get older, listen to their hearts. Say okay, because now my son and my daughter are both at risk for having mitral valve prolapse. Some of these genetic diseases are passed down, and they seem like they're benign, but they pose a risk later in life. And so we need to give the children information about who had it, what they do for it, did they die young. That's all useful information. Did they get surgery? Did they survive the surgery? For how long? This needs to all be a part of our family health history. and that's how it needs to be updated. And we should have a general, maybe a book somewhere or whatever on the internet, on your FaceTime and whatever, however you want to record this shit. But the family history, especially in the Black community, when it comes to who's got what, this shit needs to be disseminated better than it is. Because I'm finding out about this heart condition in my family that's been there for like 50 fucking years and nobody said nothing about it. You know, everybody just sitting around chilling and shit. I'm walking around at risk of suddenly dropping dead, which yeah, I already knew I had mitral prolapse, you know. Ain't a whole lot you can do about sudden death. You got to die before they do anything. I mean, I'm not joking. They're not going to put a pacemaker in you just because. You gotta drop first. Then if you survive, then you'll get the pacemaker. That's how it works. So sorry. But I want y'all to see how a doctor thinks about what he's going to ask before he goes to the doctor. So obviously you understand the kind of questions I'm going to talk. What are the absolute indications for the surgery? Because it's not the sudden death. So then we got to talk about chamber sizes, you know, the valve itself, what it's shaped like, what's the likelihood that it's going to be able to function any period of time, and what's the risk of surgery, what's the likelihood of me maintaining my current ejection fraction functional status with a complete artificial valve versus I can't get a repair because now it's two leaflets. Mitral valve is two leaflets. You can't repair both of them that I know of, but that's the question too. Could you repair one valve? Is that an option? Just let Mayo do a minimally invasive repair and have you may it may sound like a crazy question, but you got the right to ask. It's your body. Before you undergo the knife, you need to know all these questions. Okay? And then you make the best decision you can based on the knowledge that you have, and you give it to God. After that, you give it to God, man. That's how you use wisdom and knowledge. you know, you know your body better than anybody else. So deep inside, you have a deep subconscious connection with yourself. And if you do the right research and do your part, you'll be able to sit down with the surgeon and tell, like, I need to find another surgeon, like, real quick, or what he's saying is reasonable. And I've had enough evidence. I've seen enough evidence, either in literature or in real life, that what he's saying is a likely outcome. Like, I'm pretty sure getting any kind of valve before I die is going to lengthen my lifespan. Okay, I'm pretty sure that. Now the question is, at what point do you do the surgery? And if you do it too early, obviously you're gonna mess up a good heart. Okay, do it too late, and you might as well. So timing is everything with heart disease. Timing is everything, man. It's like just like with a new car. What's the timing off a little bit? You can hear that knock in your engine, your timing belt off. In the same the same thing with these surgeries, man. Timing is everything. You don't want to wait too long, and you don't want to sometimes pull the trigger too early. So you got work to do whenever you get sick. Sorry, I know it sucks, but that's what it is. The patient has to understand the basics of his disease, so I can talk to him about prognosis and treatments and therapies. Otherwise, you're sitting there, somebody talking at you, and you're just going. If you don't know, then get on the phone and talk to one of your nursing cousins or whatever. And what's this word mean? I mean, you understand something written on the paper. You're not gonna completely not understand what you read, but you're not gonna understand the technical aspects. So either look the technical aspects up on the web yourself, or get somebody in your family who's in medicine to explain what does this mean. Left ventricular end diastolic volume of 5 uh 5.4. Well, that means if your left ventricle is bigger than 55 millimeters, you got problems. That's what that means. Okay, your heart's enlarged. You need to get something done. That's the kind of information you need. Okay, technical information. Okay, left ventricular end systolic 40 millimeters, 4 centimeters. You need a certain amount of technical information before you talk to a surgeon, so you can have an intelligent conversation. Okay, then it's just risk benefit assessment, and nobody's God, man. Nobody can say I'm gonna do this to your heart, and it's all a risk. Okay, that's how it works. All you can do is come to the poker table with your cards lined up right. You know what, you got your money on the table. You like, this what I got to work with. You guys got what you got to work with. Let's play ball. You know, but it's a decision you're gonna make in your life that's literally life or death. So you don't want to make the wrong one. And the patient has all the rights. I mean, you have a right to say yes, I want to be cut, and no, I don't want to be cut. Nobody can take that right away from you. If you choose to die with your condition, that's your right. Just be ready to die peacefully. You don't bother the rest of us too much. I'm just joking. Die however you want. You want to go out naked, screaming in the streets, that's your option too. But at any rate, uh, become your own advocate, man. Become your own advocate. You know, the resources are out here. There's no excuse for people to not know about their health conditions. You should know, you should know as much about hypertension as I know, damn near, if you have it. Diabetes the same way. Certain chronic diseases, hypertension, heart disease, certain types of heart disease, aortic stenosis, mitral valve disease, pretty common, you know, and a whole bunch of other stuff that, I talked to somebody today about a health problem that it's nothing life threatening, but you just got to have some plain common sense approach to, how you're going to approach these things. And sometimes it's easy. Sometimes in my case, it's very, very technical. And it's very, very, everything is gray area, gray area, gray area. Well, my last name is Gray. Sorry, I can't make it black and white for all of y'all. Sometimes you got to walk in that gray area between life and death. You got to be in the gray area, and there's no resolution to that. Sometimes you go remain in the gray area. You know, sometimes the answer is to do nothing, just chill. It could be do something, do nothing at all, or do something but just chill. Medical therapy, I mean, it can go either way, man. But it's just certain things you got to ask surgeons, man. You got to know certain questions. Uh, and you really want to basically know how many patients have they seen in like you, okay, and what their outcome was. How many 50-some-year-olds have you replaced their valve and seen them have good outcomes? I mean, you can just straightforward ask that question, because now you're asking for his personal, right? You asking for the surgeon, what is your personal history with this disease? That's also useful on top of what you read in the studies and in the books. But yeah, this is how a doctor gets ready for a doctor visit, just so y'all know. Because I know a lot. I had a feeling this might help somebody, because I think y'all think we just walk up in there and be like, yeah, what's up, brother? Like clutch up, and then we all pass checks around and money. Then we play golf and smoke cigars and go home. But no, that ain't the way it worked. Like, before I go to the doctor, I've done a lot of research, man, a lot of reading, a lot of the stuff I may know, a lot of a lot of it is I'm learning for the first time. Like, oh, I didn't realize this. I didn't realize that replacing the mitral valve will not change your risk of sudden death at all. It will not. So do it for other reasons than that, not for that reason. Like, that's useful to know. You thinking, oh, I had sudden death, electrical problem. You gonna fix the valve? I'm gonna be like, like the Energizer Bunny. Nope, no, because that may not be what the problem is, and they may not have the ability to map your entire heart using nuclear medicine or electrophysiology, which is the only two ways you can map the heart that I know of. Like that would be electrophysiologically, or using a metabolic study, maybe maybe MR of the heart if they have it, MRI. Uh, but basically, it's a way to map out the heart's electrical systems and see if there's scarring or short circuiting. That's called an EP study. They can do EP studies. It's just not useful, I think, in mitral valve disease, because it doesn't. I think with the mitral valve, it has various places where it can short circuit, most likely, but it could be predominantly one area. I mean, they could find it out. If it's predominantly one area, then I guess the question is for the electrophysiologist. Oh, do you guys go in and ablate? But you can't ablate certain rhythms. Like, I think my rhythm was like straight in a V-tach or something like that. Ventricular, you can't ablate that. Not that I know of. That's like a malignant rhythm. It has to be shocked right away. You can try to figure out metabolically, physiologically, anatomically what's wrong with you that led to that, which is what I'm doing, and then try to fix that problem. That's why my decision tree is so hard, you see, because I have to decide whether or not, as a highly functional, physically functional person, it's time for me to undergo cardiac surgery, or should I wait a few more years, watch and wait, and see if medical therapy still maintains, this level of slow deterioration, so to speak, since I'm already in my early 50s. You know, we'll see. Those are the questions that need to be answered, man. Um, but don't go in there, just sit down, just be like, what you gonna do to me? Please, like, don't be that person, man. Because most time people come in, somebody hurt. Oh yeah, 14. Yeah, ablation is actually pretty common. They go in, they map out the heart, they do an ablation, they find the focus for supraventricular tachycardia. It's a little bit easier to localize things. Atrial fibrillation, it could be anywhere. I think atrial flutter is the same. You can't. It's hard to map those out. It's not impossible, but they have older procedure called the Mays procedure. I think it is, when they used to actually go in and surgically open up the heart, and they would take out part of the left atrium to get rid of the arrhythmia. Those are specific arrhythmias, very specific arrhythmias, atrial fibrillation, atrial flutter, right? And if they could, it's only certain cases do they go in with the Mays procedure and fix it. Also ventricular tachycardia. But when with SVT, they can often map out the spot that's doing it and ablate it. And those are wonderful. That's a wonderful feeling when you can offer somebody a curative therapy. But you can say, boom. In my case, nope, because the whole electrical system probably has something that's fucked up wrong with it. It's probably got a little scarring up here, some scarring down there. The papillary muscles have been overworked, so they got some scarring along there. You don't know where it's at, and it's not where you think it's gonna be, and you also don't know what factors triggered it. They often don't know what triggered arrhythmias. Like in atrial fibrillation, we know electrolytes, potassium, magnesium, sodium, all of that. Make sure all those things are always in order. If you have any kind of arrhythmia, you don't want low magnesium. That's a big one I read about. Low potassium, sodium being too low, just as bad as too high. So that's something everybody can work on, is making sure they eat a balanced diet. And all you lushes out there, y'all need to cut back on the liquor, man, because that can actually have it deteriorate a little bit. A little glass of wine every day. You straight. You ain't gonna do no harm as long as you ain't no drunk. A little glass of wine every day probably good for the heart. A whole bottle a day, no, no. You gonna destroy your heart. About 50 years, 60 years, but sooner or later you're gonna destroy it. So I gave y'all a little bit of a lesson on mitral valve disease here today, which is actually pretty common in peoples of color in our families. That's why I wanted to hit it, because it's getting missed a lot. It's getting missed in the young people, and we can hear the murmurs in them when they're young. As jeez, I was 16 years old when they found mine at a military physical, or 17 years old. So, you know, the plan at some point should have been always to follow it every 4 or 5 years, and follow the numbers, make sure things aren't getting worse. Which I was in the military at the time, so but at a certain age, all this stuff is going to come back to haunt you if you don't take record of it, and you got to know your own body damn near better than the doctor could ever know it. It's like that kind of a thing. So when he sits down, I'm doing good. Ob, what's good, man? I'm just was talking about how doctors prepare to go to the doctor, and showing it. I had my little list up here. I could show y'all on my phone. I got a whole list of little cuttings out of the journal article that we use called Up to Date, but it compiles all the research and puts it in one place for us. So I'm in that way I may be lucky, but I still got to know how to interpret the numbers. And everybody has Google, so anybody can Google. Basically, that's what Up to Date is a place that Google's research studies for doctors and compiles it all into one source. So we use sources like that, and then the societies, cardiology, endocrinology, whatever, they come in and they say they agree with the recommendations, they don't agree with the recommendations. Oh yeah, man, much better, man, much better. I was having these myoclonic ticks and twitches, and I appreciate the prayers, brother. They definitely, all the prayers I've been getting definitely made a difference, man. Because I think in about a week I was back up and at it, man, which is pretty amazing actually. But then if you think about it, my lifestyle also is such that I don't abuse my body. I live a certain lifestyle, drunken monk, right? So I expect some return on my investment, assuming nothing catastrophic happens. I expect my body to pay me back, a certain way what I invest in it. And so that's the other thing is investing in your own health is, I don't know. I'm gonna talk to the surgeon and see. This is tricky because this valve has been like this since I was in the army, and the valve is slowly, mitral valve prolapse. It's one of those insidious diseases. Mitral valve prolapse. It's pretty common. The valve slowly leaks more and more over years, or it can stabilize. Just one of those things, man. You don't know. I mean, I've been athletic since it happened to this day. The only thing holding me back right now is I got this new pacemaker box up here. I don't want to go and slam it, but otherwise I'd probably be down the stairs kicking a heavy bag most likely if it weren't for that. Because I'm pretty sure that this pacemaker ain't helping my cardiovascular fitness go up none, right? I got to do that on a treadmill. It ain't gonna do a damn thing for that. It'll shock me. I appreciate that, but in between the shocks, I need to have something to work with. A basic healthy cardiovascular system. Not yet. Not back quite yet. Other than paperwork that they're sending me, I got to complete over the computer. I got to have this cardiology visit and talk to the cardiologist, and then after that, we all talk about surgery, whether we're gonna do it, whether it's warranted or not. We went then when the timing, the timing. Oh yeah, I did echo. That's one of the first things. First thing they did was the echo. What's up, Robert? Yeah, I've been up and at it, man. I stay at it. My mind stays active when it needs to. And before I go and talk to a doctor, I definitely want to know, enough background information on what I have to be able to have it, to be able to have an intelligent conversation. Okay, that's basically what you want to have is just an intelligent conversation based on both people being knowledgeable. You're knowledgeable of yourself as best you can. It helps me come in with what I have and help you. How did your spiritual path help you? Well, honestly, there was never any mental frustrations for the most part. Even the process of dying was a you know I think my spirituality influenced the way I temporarily left and then came back. And the insight that I have isn't great, isn't greatly increased because I already knew what to expect before I died. It sounds crazy, but I mean I did. I mean, no, no, nothing. It was sudden, and I mean that's I don't know. The fate, the universe put certain things in place for us. So maybe I was supposed to die for a little bit, just for a few minutes, for some reason I don't fully understand right now. You know, the mental experience was pretty much what I expected, not that different. The only question I have is if I stayed dead, would I continue in that state, or would it shift around while I'm still inside the matrix? Can't answer that question until you die. But based on the skull experiments, y'all don't know about those. What did we watch yesterday? About it was the skull experiments, right? Skull. Yeah. They had all these people, these mediums talking to people that had died for 50 to 100 years. They were taking pictures and cameras that were enclosed in a dark space, and they were getting films of people's faces and writing that was 100 years old. There's ample evidence we survived death. I saw my brother and my father had a brief conversation where my father said, "You got to go back." I said, "Oh, okay." And so that was but we tend to be very stoic and stoic warrior types in my family. You say what needs to be said and keep it moving. Oh, neuropathy. Yeah, man. Stay on it. Stay on top of it. Get you some good resources. And you want to know the current guidelines for treatment. And what you want to know which patient population you're in. Am I low, medium, high risk? Where am I at in the disease process for me? Then you come in with the numbers, and sometimes it's not easy, man. Like in me, a young, healthy, athletic person, you know. He got some for me, right? He got some for me. Just this testimony may be enough. I can tell you, there's something on over there, brother. Yeah, my brain wasn't brain dead, but it wasn't functioning normally either. I was out. How long was I out for? 15 minutes?
Yeah.
15 minutes, right?
Yeah.
They were trying to shock me back.
Yeah.
Did my heart come back quick, or they had to work at it?
They've been doing CPR for 14 minutes.
14 minutes of CPR, she said. I can tell you when somebody's got a heart rhythm, you don't do CPR. Yeah, I had the real ND. Yep, I had it, bro. 14 minutes of CPR. Went to the other side. Saw my brother. Saw my father. Saw the sort of ethereal, sort of a sight being in a dream almost. It's what you that part you expect, but it's a dream that's a little bit more real. I can say that, which is kind of what I've heard about the astral plane. A little bit more real in some ways, but not as solid in other ways. So it's kind of I don't know. I don't know if it's because I'm Buddhist slash Christian and I've contemplated this for so long. Like, did I influence the situation? Did I influence the experience? Well, undoubtedly I did, because we're the ones that are co-creating this universe with God. So of course my mind had something to do with what I saw. Of course. That's why we say in my father's house there are many mansions, you know. If it wasn't so, would I tell you so? Well, you build this in your mind, man. So when you go to the other side, all I had was a shack. I thought I had at least built a 1 room cabin. I was kind of shocked. I looked around like, this all y'all got? And this what y'all doing? Y'all sitting up here in this 1 room? My brother and my father, I was like, damn, this all we got over here? I thought we'd be doing better than this, all the praying I've been doing in my life. So I'm just being funny, but I'm telling you, it's trippy, man. It's trippy as hell. The other side is trippy as hell. And my father that had nothing to say, it was almost like he was talking to me through my thoughts. He didn't say to me, you have to go back. It was transmitted through here. It was mind to mind. And my brother, it was just like, he was just, I don't know. He committed suicide. So I don't know if there's some consequence on the other side for suicide. I'm not sure. Maybe the soul has to repair after a period of time. Maybe the connection to the person on the other side is changed. I don't understand suicide completely. It seems to change things a little bit. No, I didn't see that. I just basically woke up, and I'm in this plane of existence that felt like a dream that I knew was the astral plane, or it could have been a dream too. At any rate, the astral plane does have some connection to the dreamland, and I had an interaction with with a family member that said, it ain't your time yet. So they said the most important thing that needed to be said at that moment. It ain't your time yet, brother. About face, soldier. What else needed to be said, right? My father's a Marine. That's all. Yeah, I wasn't surprised at the conversation. It was a conversation Leonidas would have with his son. Get your ass back to the battlefield. Here's your sword. Here's your rucksack. Have a nice day. That's it. that's the kind of conversation I expected. Here's your sword. Here's your fucking red cape. I feel like I was over there probably 15 to 20 minutes is what it felt like. What was it in the real world? I was out for what? 14 minutes? But when did I wake up fully like this?
3 days.
3 days?
Yeah, 72 hours.
So I was out for 3 days according to her. It felt like 15 minutes was gone and I woke up. So
No, 15 minutes, you don't have a heartbeat, and then you're in a coma for 72 hours.
yeah, I understand. Yeah, yeah. You said that 3 days. So yeah, 3 days, man. My wife was laughing. She's like, "You like Jesus, huh? You said you said I went down on a Friday, came back on a Sunday.
Thursday.
I went down on Thursday,
And came back on Sunday.
came back on Sunday. No, it was just when my father said it's time to go back. I just turned back around and walked through the door that I came through.
That means that when they show your
Yeah, they see my third eye that I got non surgery, non tattoo based. I wonder if it's gonna go away or it's probably the scab eventually. It's internal bruise is what it is.
So where did you pull up in the floor?
I don't know. I was next to a patient's bed. I think I hit the floor. Hospital floors are pretty hard. I didn't hear. I didn't. It wasn't a call back. It was a conscious decision. Like, okay, I guess it's time to go back. You know, there was that brief interaction with my father and my brother, and then I woke up. Philosophy of motor being, and Doc Rusky. um, I'm not as worried about dying. I never was worried about it to begin with. I'm even less. I'm even less worried about it now. The only thing I'm really worried about is making sure my affairs on this side are in order, so that when I pass on, those that I leave behind aren't burdened by my sloth. Okay, so making sure the money and the bills and everything are paid off and shit's paid down, that kind of thing. That's pretty much how a lot of people are. But also secondarily, primarily, but also secondarily, they're combined, is making sure that whatever spiritual practices I'm doing on this side, they need to be affecting me on that side. So I did have that to some degree, but it seems like there are other factors involved in when you cross over. You're not by yourself, so you're not just sitting in some like to complete like nothingness, like meditating that kind of thing. No, there's a great deal going on behind the scenes. So I felt like I was spiritually prepared. I didn't feel like I lacked anything, you know. Uh, no, I didn't feel it because I had been practicing at a level where I feel like I've always pushed the envelope. I mean, you know, in college, I was already dropping acid, man, to go into the spiritual side. I mean, I'll just be honest with you. I was already dropping acid in college, bro, to cross over to see what it was like. So I think a person like that who has had that much experience and then experiences with with deep meditation in the deep slate the deep levels of sleep that you meditate in as well. I think if you go through those type of practices, that death is it really becomes just an extension of life, a portal that you got to go through to get to whatever else there is, whatever else there is. You don't want to leave the ones behind you love. So you know, karmically, I didn't have to for a reason. For a reason, and maybe this is part of the reason. So I could tell you about it. But you build your house over there, man. Up here now. Build it over there here. So you have something waiting for you when you get over there. Prepare a nice place so you and your loved ones can all congregate and tell stories or whatever you're gonna do. Play checkers. You know, sit around and look at each other and wonder what the hell you're doing there. Ayahuasca. Yeah, that would be the ultimate. I think I think I think I could get into an ayahuasca state by going into the meditative state while I was in the dreaming state. There's a practice in Tibetan Buddhism where when you find out you're lucid in the dream, you consciously enter meditation, and that level of meditation is extremely deep level. And I would say if you can't get your hands on ayahuasca, that would be the next deepest level that I could think of from my own experience. Because I've only got to a certain level with just conscious meditation, you know, to get to the to get to the deeper level, the deepest levels of mind. Look, the last time I meditated, a spiritual being laid me down, showed me my heart, and there was black. I mean, there obviously somebody over there obviously is just gonna be messages. The black heart is the what's affecting my heart. I had that experience when I was going through the Tibetan book of The Dead. No, it was Tibet book of. No, it was a book on dream yoga. I was going through. I was going through a book on dream yoga, and that's when I had the experience of them laying me down into my heart center, and it was dark. So somebody's been feeding me from the other side this whole time, feed me information. It's just that they can't come down here and tell me you got to do this, you got to do that. You know, at the end of the day, you still got to make the decisions because it's you. So it's no easy answers, you know. But you definitely can make it a lot easier for yourself if you prepare spiritually. I think the mental, it's gonna be frustrating when you know when your mental is not 100%, man. It's when especially when you function at the level I do. You have to learn how to just be at some point. Issues, just ignored it. uh, I mean, I knew I was having a semi spiritual experience though when it was happening. So I was just surprised at how unpredictable the experience can be. You can't really predict it the way you think you can. It's going to be based on you, your experiences, which people have passed on before you, what your relationship was with those people. Have you spiritually been able to enter that plane of existence because you desire to? Because that's part of the preparation is going into deeper levels of meditation and visualization, visualizing these deities. I was visualizing these Buddhist deities when I had the experience of being laid down and seeing that my heart was some blackness was in my heart. They were showing me the disease, but also it was a dual lesson. It was also to show me that to meditate on my heart chakra was one of the most important meditations I would learn in my life. Learning to meditate on my heart, on and as a part of my heart chakra. Obviously, there's a deep lesson in the heart that we all have to learn. I'm still learning it. I can't tell you that I know exactly what I was told over the other side when I got that. But I'm telling you, one thing I got from being in a deep dreaming state and meditating and meeting spirits, deities. The second I got from being dead, and that's what happened when my relatives were there waiting for me. So, yo, Thich Nhat Hanh, yeah, historical and ultimate. I mean, being like Thich Nhat Hanh, these are bodhisattvas. The bodhisattvas are by definition spiritually at the point where they could, cross over.
Okay. She says you need to call her.
Oh, okay.
She just finished reading the.
All right, yeah. They've reached enlightenment, so to speak, but they keep coming back for the benefit of everyone. Thank God. Yeah, 15 minutes. Interesting experience. So my brother saw my dad. They said, "Go back. That's your time." I said, "Okay," and I came back. Pretty much that sums up the experience. There's a few more details, but that's just to make the story interesting. That's pretty much how it happened.
Okay.
Hmm.
So she said call her.
I'm gonna call her.
She finds something that you wouldn't like it, that they didn't tell you.
Really?
Yeah.
All right.
Bye
My
bye.
sister is looking over my business for me. She's telling me somebody's trying to get over, so let me go see what's up with that. Yeah, man. Hopefully somebody got something out of this. If spiritual, physical. If you got mitral valve disease, heart disease, something. I mean, I kind of scope kind of loose like this because this is my bedside manner. I don't talk to people like I'm their teacher. Do this, do that, do that. Yeah. Where did you experience? I was at work at a patient doing surgery, and then I dropped. Imagine that, right? Yeah, man, it's definitely. I'll try to answer your questions as best I can because I'm still correlating the whole experience and putting it all together. You know, but I mean, there's definitely something. The mind is. I can say without a shadow of a doubt that the mind is much greater than what we experience with waking, the superficial sleeping state. Okay, and meditative states that don't go beyond a certain level. Okay, the mind is much deeper than that. That's 100%. You know, our job is just to enter those states consciously at will, and being able to function in at that level. That's what takes all the lifetimes of work to be able to be in person of the spirit and of the body and still function in both. That's why it takes a Thich Nhat Hanh, right? But that's the work that we have ahead of us. I can tell you it's worth it because the experiences that I've had on the other side have been partly dictated by my desire to learn and my childlike approach towards life. Beings that I need to be there for me are there for me. They give me what I need, and then I go back. My father and brother, they gave me what I needed. It ain't your time. I came back. I don't think on the spirit side that I don't on the spirit side they don't seem to be too prone for like idle chat. It's like they go to the point of the problem. You go to a bodhisattva with a problem, you know, they're gonna show you your problem. Okay, and it's gonna be a physical and a mental and spiritual lesson. My heart may be broken, maybe, but maybe not just in a not just a physical sense. Maybe things happened in my life, you see, that have given me a broken heart too, and they're also showing me that you need to repair your heart at more than one level. See, this is what you have to get. Nobody's going to teach you that. If they give you the lesson, they give you the lesson. You know, you have to interpret the lesson that you get from the other side, and you got to know what it means. So I work on my heart all the time, man. You know, thankful, loving the people. I've always turned down quite a bit, but I'm an energetic person. But I'm turning down, man. Like all of these crazy interactions that people want to engage in. If it's not fruitful for both parties, I'm not a part of that. You know, I'm not a part of that chaos. I don't want to be the author of chaos in this world. I want to be somebody who brings peace and order around me. So that's a choice. And there's so much more for me to learn, you know, that I could even begin to articulate it. I know there's something other than the physical. I can say that for a fact now, having gone over there once on the LSD, twice in deep sleep meditation, third time in death. So now I've been over there 3 times. It's a couple of times that I don't care to talk about. I wasn't dead, but those 3 times, you know, have shown me that we're just scraping the icing off the top of the cake with what we're experiencing. That's the best way I would say it. That our spiritual experiences at this level, we're just I don't give a damn if you're bored. Go play in your room. Hey, go upstairs and play in your room. Don't ever say you're bored around me. That's the worst thing you can say around me, bro. I put your ass to work. You want some work to do? You better go hide then. I'll find something for you to do. Go up to do what I told you, boy. I said go to your room. Why you hesitate? You deaf? Y'all know about the old school. I'm old school, man. That's how we talk. You don't fuck around. You do what you told. But I learned to listen when I was a kid. I learned to listen, and I did what I was told. So